A 22-year-old female presents with a sudden painful swelling in the neck. She had a recent episode of sore throat with fever. Thyroid profile was normal. It was in normal range. A clinical diagnosis of acute thyroiditis was made. All except are true for the thyroiditis. So basically, now we have to understand the various form of thyroiditis. Very quickly, I'll compare all the thyroiditis in front of you, and you will have a basic idea about thyroiditis. So when we talk about thyroiditis, there are 2-3 things that we all have to understand. What are the types of thyroiditis? What is the initial presentation for them? What are the associated complaints? Let us see. We have 4 thyroiditis. We have acute thyroiditis. We have subacute thyroiditis. So we have acute thyroiditis, we have subacute thyroiditis, we have chronic lymphocytic thyroiditis, and we have chronic sclerosing thyroiditis. So let us try to understand them. What is acute thyroiditis, subacute, chronic lymphocytic and chronic sclerosing? What they are also known as? This is also known as suppurative thyroiditis or bacterial thyroiditis. This is also known as de-Quervain thyroiditis. This is also known as Hashimoto's thyroiditis. And chronic sclerosing is known as Riedl's thyroiditis. Let us try to understand. Association. This is bacterial. Subacute thyroiditis. It is either viral or postpartum. Chronic lymphocytic. It is autoimmune, and this is lymphocytic infiltration. So autoimmune with lymphocytic infiltration. Riedl's. It is again autoimmune, and this is IgG4 related. The next is, what about the pain? Acute is painful. Subacute in this viral variety is painful, whereas postpartum is painless. The reason is the virus is entering the body from outside. In postpartum, it is the female's own cytokine storm which actually stunts the thyroid. So no one is entering from outside, so retaliation with the gland interface is not there. Similarly, in case of chronic lymphocytic, it is painless, but initial, always remember, when lymphocytes would have tried to enter, there will be a short painful phase. Riedl's is something where the gland undergoes fibrosis, so it's a true painless thyroiditis. Then what about leukocytosis? Leukocytosis is plus only, this else not. ESR, it is elevated in bacterial also, in viral also, but postpartum it is not here. Then what about thyroid function? When we talk about thyroid function, it is always euthyroid, hypo, and euthyroid more than hypo in this case. When you talk about management, conservative management is done in the first and the second. Here T4 supplementation. Always remember, surgery if there is a suspicion of what? Malignancy. Do you know what malignancy? It is associated with what? Papillary CA thyroid. So may be associated with papillary CA thyroid. Here we go for steroids, or you can say even tamoxifen has been known for its wonderful what? Anti-inflammatory properties. Or mycophenolate. These are. Along with this, what else is important? Surgery, do we require? Surgery in this case is only done if there is, you can say, compressive features. compressive features. There is a hard, you can say hard fibrosed stony mass, and this might cause a compression or indentation over the trachea. So in this case, we don't take out everything. Rather, what do we remove, students? We only do a resection of the what isthmus of the gland, so that the compression of the trachea is relieved. So just see this question. Suppurative thyroiditis is associated with leukocytosis. True. Postpartum is painless. Chronic lymphocytic thyroiditis is very common in females. 20 is to 1 is the ratio between females is to males, and two-thirds of them are perimenopausal. So this is also true, and riddles is managed with steroid. So B is the answer of exclusion also. Because it is not always painless also, but still it's there. So answer of exclusion.